I call this a coffee talk because I'm going to sit with you and talk. Most of the time we have whoever's presenting information, they're going to be up standing around and talking to you, at you like this. And I'd rather have this as we're going to sit around and we're going to have coffee and we're going to chat about what's going on, about this new information, and you get to ask questions. And question parts are really important. Reason for that is hopefully I will be piquing some questions for you. So questions are going to be really important to get them answered for you. It's one of the things when I do my report of findings, I really try to make sure that I've covered what it is that you've got, how bad is it, can we fix it, what does it take to get it fixed? If you don't get it fixed, what's going to happen? So trying to get all that information in. Likewise with doing these type of talks, I want you to be able to ask the questions so that later on you start making decisions or choices or go, I think that's a good idea. I want to take a look at that a bit further. So questions and answers are going to be real important for us. We're going to have another talk in the near future on peripheral neuropathy. So peripheral neuropathy, anybody heard what that is, know what that is? So peripheral neuropathy is where you have nerve death on the outside. So commonly we'll see this with diabetics. So diabetics will have the nerve death down the legs, tingling into the hands, etc. That's a neuropathy. We can have neuropathy from a bunch of different reasons. Drugs can cause that, diabetes can cause that, some deficiencies can cause that, nerve compression at the spinal cord or nerve root level can cause that. So I have a picture of an 81-year-old gentleman that was getting treated with Dr. John. And I come around the corner and I see his leg. And I talked to Dr. John about it. And he goes, he's got zero money. I came around the corner and I said, look, you've got this neuropathy going on. Will you let me give you some treatments? I said, no, it's free. I just want to give it to you. I can't have you sit here and see this and not do something about it. So this was his leg. This was his leg. And while we were doing the traditional chiropractic treatments, it wasn't getting the nerve to regenerate. So we started doing cold laser therapy twice a week, and this is the 2 weeks. Now, at this, you'll see some little drops on the skin. It looks like little sap. That is the interstitial fluid leaking out through the skin. All the crusty stuff on the previous one was that fluid crusting up. So here we are at 6 weeks, and here we are at 8 weeks. Actual pink skin. And take a look at the foot and the heel, how little black there is. It's almost completely gone. This is just in 2 months. So this is the new advanced treatments and therapies that we have for regeneration. And this one is just talking about cold laser.
Wow, he must be excited.
Excited. He's also able to walk better. So with neuropathy, you lose that ability to balance so well. Yep. So we've got one of our gentlemen, actually, me and my big mouth at a restaurant. I said, why are you limping? He had a cane. And so I just started talking to him, and he told me, I says, you want to get that fixed? And I says, I'm sure your wife would like to go out dancing again. And she's, yeah. And so we started treating him, and he started getting his nerves to regenerate as well. And he's still in the process. He's using our follow-up therapy, and it'll take about 2 years for him to get that worked out. So we're working on that.
How does that work with nerve compression for neuropathy?
So there are several things that go along with that. Sometimes the nerve has actually died. The blood supply to the nerve is dead as well, is congested, collapsed. And so this is where we use a therapy called a nerve plate. And a nerve plate is a specially tuned vibration. So on the nerve plate, it's tuned to vibrate to the point that it stimulates the regeneration or the regrowth of the nerve. It actually grows, I think it's 1 centimeter every week, which doesn't seem like much, but prior to this, you couldn't grow the nerve back. Once it was dead, it was gone.
long do you have to do the play?
The plate can be done for probably about 2 years.
But the right generator is compared to like
Nobody's done any research with it. I'm a big fan of the Rife generator, but nobody knows how well or effective it works. Spooky2.com has Rife generators. Spooky2.com has Rife generators, and they have all the frequencies downloaded for whatever you want to do. Rife frequencies are energy frequencies that your body can absorb the energy and it affects your body physiologically. So, like you go outside and you absorb ultraviolet light and you turn it into vitamin D. You're transferring this energy into a different human form of energy. So, when we do cold laser, the photons from the cold laser are absorbed by the mitochondria and the nucleus of individual cells. So, you're transferring this light energy, the specific form of light energy, and it's absorbed by the specific components of cells. So, you're actually healing on a cellular level. The Rife generator is a different energy frequency that does a similar effect. Every organ, every tissue, everything in the body. Now, how much research is on that? There's not much because you can't patent a naturally occurring item, and that's naturally occurring, and you can't charge tons of money for it. So it's not going to make it into the medical annals, and nobody's going to put money into researching it. And our federal government, which is supposed to be researching all healthcare, does not. They only research what's going on from pharmaceutical or the medical health complex. So we have a great way to save. And again, I'm an example with the heart transplant. If we hadn't had all that research, I wouldn't be here. So we just have to realize that while our traditional medicine will save your life, it won't save your life in the long term. So it can't make you healthy. Every drug has a negative side effect. So we have to balance out, is the side effect worth the benefit? And then go from there and make your choices. Okay, so let's get started with this. So we want to talk about regenerative medicine for joints. And that goes for joints for the knees, hips, pelvis, spine, wrist, back, necks. And we're going to talk a little bit about how regenerative medicine can work for you, and then what you can make questions on or have work for you for your best answers for your health. Now, if I could tell you that with regenerative medicine, we can increase your vitality or health 60 to 100%. Anybody interested? Yeah, good. We really like that idea, but is it one of those things that is too good to be true? And oftentimes we look at that, but really the information that's coming out now is, yeah, you can regenerate. You can make things brand new. Now, how do you get there? That's going to be the question. What does it take to get there? Part of it is going to be a lot what the patients do. So our regenerative medicine isn't a silver bullet. It can be in a little bit, but you really have to do the follow-up and do the homework on your own. I had a patient that showed up from, gosh, probably about 7 years ago. And she came in and she says, yeah, I've been doing your exercises ever since. You made me start doing them. And I was like, good, it kept you out of the office, didn't it? She goes, yeah, pretty much. So it's real important that we do your homework, and that's why I give it to you. So the question we got to ask is, are you experiencing these pains? Are you experiencing hip and knee pain, back pain? Is it constant? Is it chronic? Is it something that is debilitating for you? Is it anybody have any of those pains? Good. We got a participating group. So the thing of it is, with regenerative medicine, any joint is available to be healed. Any joint is available to be assisted to regenerate. Now, case in point for me, I was trying to get my left hip to regenerate before I had hip surgery. The body moved the stem cells from the hip to the low back. Now, let that sink in for a second. The body moved these stem cells to a place that it felt it was needed more strategically. I was doing my hip regeneration so that I could exercise to lose the weight to get the back to heal up and regenerate faster. The body said, oh no, we need the nerves going to the hips working better than we need to have the hip working. So it moved, and my low back, 2 days after my injection, my low back felt like somebody had just taken a sledgehammer to it. The body was actively working on regeneration, breaking up scar tissue and putting new tissue into there. Yeah. So yes, it was like I didn't realize what was going on. So I asked my consultants that have been help training me on all this. Then they said, "Oh yeah, it moves. The body moves it where it wants it." So I have to figure out what is the priority for the body on different people's parts. All right. So I want you to pay attention. If you're 55 or older and you want to act like you're 35 again. Yeah. My male brain's going like 35. I want to be 25 again. But we tend, particularly as men, we'll try to work ourselves into that arena. And ladies, y'all taking care of all of your business. My wife is included. She would be here, except she's taking care of other stuff. You just keep going and plowing through until you just fall over. So pay attention if you're into that category. Pay attention if you want to get back into doing sports, playing golf, taking walks, skipping rocks. So all these things that we used to do leisurely wise, we can get back into those. We have to figure out what part of the body is hindering us from doing that. So gardening, extremely healthy for us, but if you can't get up and down, it's going to be very difficult. So we have a little bit of a testimonial on gardening since getting to some of this regenerative medicine. How has that worked for you?
Incredibly. And it's been like 6 months.
6 months, and you're gardening, you're cleaning the house, you're moving the heavy furniture, you're vacuuming everything.
And I mowed and edged the yard yesterday morning. I've got a third of an acre. I clean my own house. I run the streets. Don't take my car away from me.
Yeah. Yeah. You might tell us what your housing situation was, your fear before?
My daughter bought a 76-acre farm, and it has a nice little 3-bedroom house on it, and she wanted me to move into it. And I'm thinking, no, I'm nursing home material. I don't want to do
Pause
that.
right there. You felt like you were going to have to be nursing home material. And now, how are you?
I'm mowing the yard, I'm doing everything,
Yeah.
and I don't hurt. This is the big thing. The pain is gone.
Yeah. So now you have the option of taking care of yourself wherever you want to be. That's beautiful. So good. So I didn't plant her here. She's been a patient. She was kind enough to come in and give a little bit of a testimonial so that you can hear. It's just not the doctor talking. It's somebody that says Access had these results have occurred. So therefore,
What they need to know too, I had back surgery and I have rods and I'm held together with scar tissue.
yep.
But I was driving my husband for chemotherapy on I-30. This has been 1999, and I got hit in the rear, pushed into another car at 8 o'clock in the morning. It broke his neck, and he died that day. Now I have residual neck problems.
Yep.
And the doctor wants to stabilize it, which means I won't be able to turn my head. Told him, no, don't want to do that. I'm 82 years old. Why would I do that?
So we have this process going on. She's improved, getting better, and then we'll see how much more if we need to do anything other with the neck to get that to reverse still. But it takes time, it takes a process to go through this, and I'm not willing to load you up with everything up front. I want to say, what would I want to be treated as? Let's do this amount, see how much it works. Do I need to do more? I want you to pay attention if you want to stay out of the nursing home. If you want to be independent, stay independent and taking care of yourself. Pay attention to what we're going to talk about. So, anybody heard about having bone on bone? Anybody have bone on bone pain? So, we're going to talk about bone on bone pain. We can get that to reverse. It all depends on how much cartilage is left. Can we have enough to grow it back? If the bone on bone is now remodeling the bone and it's invaginating on each other, no, that's going to be a replacement for whatever joint that is. So up until that point, we can get those cartilages to grow back.
How can you tell?
X-rays.
Oh, okay.
X-rays will let me know. Okay, after today, I want you to understand what these challenges are. And we're going to challenge some things about what we've always known to be true. What we've known medicine to tell us is the truth. It's not necessarily the truth anymore. We've learned new things. Information has changed for us. There are proven methods to get lasting relief now. It's well researched. Some of the other ones where we're doing regeneration on the spine is not as well researched, but that's simply because the spine surgeons don't want to do it. All right. But we will talk about some simple steps that you can take to feeling better again and taking care of yourself. Now, knee pain in America is affecting 1 in 2 people. Painful arthritis by the age of 85. Now, we start taking a look at that. It really starts about the age of 50 to 60. We start seeing the problems. And if we can get you earlier in that scenario, we have a greater chance of spending less money and getting better results. 2 to 3 people overweight, and that has a cause to have some problems with that joint to damage as well. So that is part of the components that we'll look at with that. We will have in the future, very near future, some weight loss programs that will actually work. So again, new science, new information that's coming out. All right, now part of the thing to take a look at is, are we getting tired of taking the medications? Absolutely. It's just a matter of you add one on top of another. I was just at because I did the heart transplant, had some stuff going on. Go see the dermatologist. The problem is the drugs coming out through my skin. Go see the dermatologist who's going to want to do another drug. So while I will go take care of that, I've got to start looking at how can I assist? Is it the kidneys or the liver that's causing this problem? How can I upscale my body's ability to work for itself? And unfortunately, there's very few medical professionals that have that information. So we as consumers must be well educated on our own. That's one of the things that I strive for here, is to keep people educated. Anybody hear about the opioid crisis? How did that get created? Knee pain. And all they had for it was a drug that accelerated the degeneration, that created dependency on the medication, that created a generation. Even one of my hardest things to do is to get my 70-plus-year-old patients off of their pain meds and off of their muscle relaxers. Does a muscle relaxer actually relax a muscle? It talks to your brain and says, I don't care.
Yeah. Oh. Yeah, and the whole opioid thing starts with, you start with Tylenol, then you get Tylenol PM, then you get Tramadol, and then, okay, that's not strong enough now, so now we're on hydrocodone. And hydrocodone isn't enough now, so now we go up to the next step. I'm a nurse, that's the only reason I'm saying that.
And so,
Yeah.
and
I'm
now
thinking hospice
now we
patients.
can't. The pain management docs don't have those drugs available because they were abused so badly. They really are necessary, but if you're not getting at the root causes of the pain, is not a lack of opioids. So we got to get at the root causes of these things. So what makes a normal knee? Okay, so this is an X-ray. Is my pointer pointing on this? No. Okay. So these are the boundaries. Right through here. Nice, clear, high, black level in there. That's looking good. That's a normal looking knee. The knee is one of the more complex joints in the body. The knee replacement is probably one of the harder joint replacements to recuperate from, because it's a weight-bearing joint, and we have to consider the internal workings of the knee. These cruciate ligaments in through here that stabilize it front to back. You have ligaments that stabilize it side to side, but because of all these muscles and tendons, it wraps around this thing and it's highly mobile on everything. And you must stabilize all components on this. It is a 3D in constant motion with severe stress on it. Okay? When we start doing the medications, and particularly look at doing injections with steroids, the cartilage will degenerate. It starts to dry out, crack, and degenerate and become arthritic. You'll actually start putting calcium deposits in there trying to make it stronger. Now, I like analogy. What happens When you get your alignment out of your car, what happens to the tire? Anybody, Mr. Mechanic?
It gets wore out.
It wears out the tire improperly. What happens if you put a brand new tire on it? It's going to do the same thing again. So just by turning off the symptom or changing that symptom doesn't change the cause. So the symptom tells us, yeah, this is a problem. We need to address the symptom, but how do we get to the cause of this so it doesn't keep recurring? That's what we've got to take a look at. So we don't want to wear the joints out too fast. So what are your current choices for help? What can we do today? NSAIDs. NSAIDs are being used across the board. They found these, they started using them all the time, every time, like candy. Does that help your ligaments, tendons, muscles heal? Or does it suppress the healing? It suppresses healing. So it helps to take away the pain and stop the inflammation, but when you tear the tissue up, it leaves debris. And so when you do the NSAIDs, it takes the water out, takes the pain out, and it leaves the debris so that you create scar tissue, scabs that create adhesions. We've heard of this. How many people have heard that somebody had a surgery, they had to go back in and release the adhesions? This is stuff getting glued together that's not supposed to be. It's getting healed improperly, and it's gluing to everything else around it. That will then also accelerate the joint regeneration, whether that's a knee, hip, back, elbow, spine, cervical, whatever. It accelerates that process. And that's with just the stuff that you can get for yourself over the counter. Aspirin included. Anybody have any idea the side effects? Stomach ulcers, bleeding, death, 1 in 160,000 from aspirin. And that's aspirin. Okay? Fluid retention, high blood pressure, kills kidneys, heart problems developed. And ultimately, the biggest thing is it interferes with your body's ability to create quality scar tissue. If you don't have quality scar tissue, you cannot regenerate the joint. So what happens with cortisone injections? They feel good after you get them because everything is numb, but then you're going to have the bone start to thin out. The ligaments wear out. The cartilage gets thinner and wears out. You actually start getting the bone to compress with this. Anybody here how many steroid injections that you can get in a year? 3. Why is that?
Probably because it's such a negative effect on the body.
On the whole body, it will kill you. So it has to be used very judiciously. I'm a fan of steroids because it saved my life with the heart transplant that I had. But they were doing this. They kept saying, man, your kidneys are doing great. They expected my kidneys to crap out completely and have me put on dialysis. If they hadn't given me the steroids in the hospital, I would have swelled up and blown up. It would have killed me. The swelling would have killed me. So they have to use the steroids to keep you alive. So again, it's that balancing act that you have to take a look at. I'm not saying these things are bad, but there's a balancing act.
Okay, so you have steroids. Is there a time period for it to get out of your body? Is there anything you can do once you get the steroids to get back to that created?
The body's going to release the steroids, but damage is done right then.
So there's no repairing of the damage that's done from the steroids?
We'll take more time later to repair the tissue, yes. But if you've already got damaged tissue, you're not doing anything to repair it,
Medium therapy.
you're in the hole deeper. So if it's hurting damage now, you get steroids, steroids drop you down in the hole. What have you done to get out of the hole? Nothing. So yes, you can get out of the hole, but you're going to have to do things that we're going to talk about to get out of the hole. Okay, so the steroids actually more or less will eat your joints up, allow the joints to degenerate. So what can we use with this other treatments that you can use? Hyaluronic knee injections. Anybody heard of this? Hyaluronic acid. So this is the chicken comb. They take that stuff and they stick it in. It's a gel that goes in. It works as a spacer. And that's all that it really does is it puts a gel inside the knee joint or inside a shoulder or wrist, and it just separates that to give you some extra space. So if you have a tire that's lost its air and you put air back in it, you didn't plug a hole, what's going to happen? It's going to deflate again real quickly. So when we use these soup parts and hyaluronic acid, you're putting a shock absorber, you're putting gel inside there, but you didn't repair why you need the gel. So it's just going to leak back out again. That's one of the things that we won't do in our office is doing the hyaluronic acid.
Okay.
It is now covered with Medicare, but it's not very effective. And it's not long lasting. We've got a study that shows that the PRP injections are twice as effective, twice as fast, and last 3 or 4 times longer than the hyaluronic acid. So if you have a very short acute injury, hyaluronic acid allows you to get a shock absorber in there. If you're young enough doing all the right things, then you can probably repair and heal yourself. But how often does that happen? I've not heard of one. I just know that the literature talks about that. So we have to take a look at what are the goals of our therapy. Is it to stop the pain or is it to get to the root cause and heal things? So these gel injections are really just going to help it feel better for a little while, give it some spacing, but it's not going to let it stay in a good place. So I like the analogy of you got a rusty hinge. So it's creaky, it's breaking, and eventually that thing will break apart. We've got to get the hinge to repair enough to make it mobile enough so that it works properly. You can do a total knee replacement or you can replace that hinge completely. The problem is one of the harder surgeries to recuperate from. I'm not opposed to that. I have an artificial hip on the left side. I was back to work in 3 weeks by using my cold laser and other therapies, which should have been 3 to 4 months. But using regenerative medicine after a surgery that was absolutely necessary, I was able to get back in the saddle quicker. So if we have knees that need to be replaced, we can help those regenerate quicker. So we do need the knee replacements at times. So the total knee replacement problem areas that you have with that is you get blood clots and infections that occur from that. 1 in 400 die within 30 days of a knee replacement,
Especially the elderly.
especially the elderly. So we really need to ask that question, can we regenerate the joint, or are we going to have something like this occur? So what have we learned so far? Some popular pain relief. They can be effective to stop pain. How effective they are at giving us health? No. Do they accelerate the arthritic conditions? So when how does the normal knee move back and forth? How does it not work becomes a bigger question. So we looked at the healthy knee and we take a look at this knee. See how it's slid over to the side? You've got this trabecular pattern coming out through here. This is calcification, trying to stabilize the joint, trying to fuse it together. You have the shock absorber material that's pretty well gone. You're grinding this thing out. It's not working right. The more you use it, the faster it's going to deteriorate and get worse. The more medications that you use with it, the faster that's going to deteriorate and get worse. The more you do that, the more the hinge is going to seize up. So as I said earlier, the knee is one of the most complicated joints to use with weight bearing, particularly weight bearing. You have all these various muscles that are involved with this with their tendons. Just one of those things out of position in the wrong spot is going to cause a problem. So we're going to talk about not just regeneration in a minute of the joint, but how do you stabilize that joint so it doesn't keep recurring. We don't just want to retread the tire. We want to make sure that why that tire got in trouble, that alignment is going to be corrected as well. So it's not just one component. It's not just a shot that you need to have worked with. So you have what's called a muscle memory and proprioceptors. So one of our platforms back here works on proprioceptors. So our vibration platforms makes us work where are we in space. Proprioceptors tells me that my arm is at 90 degrees beside me. I don't have to see that. Now I'm at about 120 degrees. I don't have to see that because my sensors in the joints are telling my brain where it's at. When you start getting improper signals, then you get improper results. So stupid actions get stupid prizes. So we have those joints, we have the receptors that need to be retrained as well. So this comes into some of the physical components that need to be done. So question, how if you got a crooked knee, how are you going to get that thing uncrooked? How can you keep using it if it's going to be in the wrong spot?
Probably the right spot.
You got to put it back in the right spot and then strengthen it up. Okay? So doing the same thing over and over, expecting different results, insanity. Albert Einstein came up with that one. I didn't know he did that. All right, so the new option, the new way to take a look at joint pain, particularly knee pain, is going to be number one, restore the joint. You got to restore the neurologic component, the control, and then you've got to reset the proprioceptors and the muscles to strengthen all this kind of stuff up. So R and R. Regenerative compounds that are available today: PRP, platelet-rich plasma, Wharton's jelly, and stem cells. So, anybody heard of these phrases? Okay. So, PRP is the base level of the growth factors. Wharton's jelly is a more advanced, faster acting, more complete. Stem cells, the highest level. It also goes cheapest, middle cost, highest cost. Okay? Now, depending on what people have, can we do just the very basics? Yeah. Other ones need to have more advanced. So how does a platelet-rich plasma work? So we're going to draw blood. We take the blood, we put it into a centrifuge, we spin it off, and then we're going to draw off this level right here that is just chock full of growth factors, these platelets that go into the tissue and will increase your body's ability to heal something 1,000 to 2,000%. That's huge, huge. And then if you use the Wharton jelly, double that, stem cells double that. Okay? So very exciting materials. The neuromuscular reset, that's where we're doing the chiropractic, the physical therapy, the rehab, the home exercises, the things that you have to take care of with it yourself, making better choices. So what does itis mean? Anybody know? Don't answer, you know that one. Anybody else? What does itis mean? At the end of a word? Inflammation. Joints, arthritis, inflammation into the joints. Okay? So it's really funny when you go to the doctor, it says, "Doc, I've got my elbow, it's just giving me troubles. You got this age, oh, you got lateral epicondylitis. Oh, thank God for telling me what that is. What do I do? Well, we're going to wrap it up and give some anti-inflammatories, etc." All he did was say, "This part of your elbow is inflamed and hurt," which you came in and you told him that. He just gave a medical term to it. Didn't know why it's there, but what are you going to do about it? Well, let's just take the inflammation out, not fix why the joint is inflamed. Interestingly, we can use cold laser. So we talked a little bit about it originally. Cold laser is the photons of the cold laser are going to be absorbed, and it accelerates the body's healing capabilities, doubles or triples it. So that leg that you saw, the leg that was dying, I'll show you in a minute. That's what we use, that cold laser. Those photons are being absorbed by those cells, and we're helping to regenerate the skin. Lots of peer-reviewed journal articles that talk about how cold laser works. Now, there is a level above that. It's called hot lasers, level 4 and 5. You can use those for cutting things and doing eyes. Yeah.
Okay, so so I know, because the laser is going inside, so I know a lot of times they put ice, like you just ice the leg. So that's a graduation from just putting ice on your leg?
Yeah.
And then the cold laser gets more internal?
Yes. The cold laser is working on a cellular level. The individual cells in the region are absorbing this, and it sites them, and they're caused to heal double or triple the time that you would normally do. It helps to knock out pain, decrease the inflammation, and accelerate the healing process.
Okay, and then ice on the knee or whatever.
Ice is still, no, you're going to use ice as well. So now what you're doing, two different modalities. You're working globally,
Okay, ice.
and you're working on individual cells.
Okay,
Both are necessary.
okay,
So yeah, we add that to that.
okay.
So it's not either or, it's both and.
Both, okay.
Yeah. All right. Pulse wave therapy. Has anybody had that shock wave or pulse wave that we do here?
No.
That's what this is. So this is some really neat information that's come out. Lots of research on this. A lot more out of Europe has come out on this. And this pulsation of hitting this tissue and the reverberations through the tissue will accelerate the awakening of your stem cells, your own stem cells that are left inside your body. The stem cells starting to wake up. It releases a trigger for the body to heal the tissue in that area. So it sets off flares and beacons for the body to heal. It's also going to help knock loose the scar tissue. So the scabby stuff that's holding on to you is being said, hey, let go. And your blood vessels are told to open up and get blood to travel through them. Pretty impressive approach. Now imagine for a moment that you need to get up and down stairs, getting in and out of cars, walking around, taking trips, enjoying stuff. One of my patients that we got him finally motivated to follow through with his exercises in rehab was he had not gone to Argentina. He traveled everywhere in the world but Argentina and Antarctica. He found out that there was a cruise line. He had cruise miles left. And then he started working out so that he could regenerate his joints in his back so that he could actually walk in Argentina. So what do we do from here? Your next step is simple. I want you to reserve a spot where we're going to make the availability to have a consultation, get an evaluation, and then also get a treatment with the EPAT machine to see if this regenerative medicine might be something that would be helpful and beneficial for you. Okay? If you're not a candidate, I will tell you what your other options would be then as well. When you come to this, I want you to bring somebody that's close to you. Spouses work pretty good, unless you're not talking to each other. Don't like each other anymore. Brother, sister, siblings, a close friend. Why do I want you to do that? It's because your significant other or friends are going to hear half of what I tell you, you're going to hear the other half. And so questions, you will then be able to talk through this of what's going on. That's why I asked you to bring somebody here with you today, was so that you could talk through the information later. Okay? The trial treatment, we need to see if it's going to be responsive for you. If you respond positively with the first treatment, not everybody does. And if you don't, I don't want to treat you. It's not worth your time, money, and effort if I truly don't believe that it's going to be something that's benefiting you. Okay? And I've had patients say, can we just say, no, you can go somewhere else and do that. Because what's going to happen is it's not going to work. You're going to come back and say, I've spent $2,000 doing this, I didn't get any benefit out of it, and I'm going to be the bad guy, even though I told you it wasn't going to work. Or I have patients that won't do their homework, and I tell them, you can't blame me if you don't get the results. And people come in and start saying, well, I said, did you do your exercises? No. And I said, good, you deserve to hurt. Let's get you fixed. And we'll send you back out there. I'm the Fram oil filter guy. Let me change your oil filter or I'll change the engine out. I don't mind putting a new engine in every 2 months. Okay? So initial visit, what that looks like is this consult, evaluation, and we'll do a trial treatment on whatever body part that you have that you're interested in. The normal price for something like this is $250. So what we do with this, when I do these things, I don't want to do bait and switch or this and that. So rather than say, let's just do it this way, $50, pay $49, get the treatment, get the consult, get the evaluation. And I'll even tell you this, you will pay this in advance, but at the end of it, you go, Dr. Bradley, I just don't think that was worth it. I'll give you your money back. Why? Because it is not worth it to me to have a bad reputation. But I'm not going to do it for free. Fair enough? All right. So who should come in for the evaluation or who should not come in for the evaluation? If you're not really that serious about getting it taken care of now, don't waste your time, money, or my time. My time, I don't have time left. My days are completely booked. So when I come in and I'll do these consultation and treatments, it's on my off time. But I'm willing to do that. My wife may get on to me, but I'm willing to do that. But if you're not willing to take the steps, I don't want to even take that next step. If the $49 is a real stretch for the budget, I don't want to be contentious on this, but most of the treatments and therapies, part of it's going to be covered with some insurance, but most of it is not, because it doesn't fit the medical complex. The hospitals aren't making money, the pharmaceutical companies not making money, it's not covered. As soon as it does start to get covered, prices are going to skyrocket. Now, I do encourage you with this. If I pique you with this, you want to take that next step, do it quickly. One, because the longer you wait, the harder it's going to be to get it to fix. The more it's going to take, the more expensive it's going to become. The Fram oil filter guy, we got a filter that we can change out now. You keep waiting, we're going to have to do the whole thing a lot worse, or you're going to get past the point where it's not going to work. All right, questions? Oh, tell us your experience with how well you have done.
Okay, I've had PRP injections in my neck and also my lower back.
Start with the neck, because that was the worst.
Yes.
So we could throw a dart at you, and anywhere we hit, oh, that needs regeneration. Why did I start with your neck?
It was, needed help.
The worst, because everything from the brain down goes through the neck. So if we get the low back treated, and you still have the neck being strangled, the low back is not going to get as much help. So we started with the neck, and as soon as you got done with the neck, what did you tell me?
I could tell a difference. I felt more better mobility in a couple, maybe a week or two.
In a week or two, mobility increased, pain levels was down. What happened to your energy level?
It was definitely improved.
Good.
And another thing that was just a byproduct was I was having many migraines.
Yes.
Okay, and in like 5 weeks, I've never had that, and that was back in
We know
March.
each other.
So no more migraines. I love that.
Yep.
So then you said, I want my back done. This feels so good. Now I want my low back done. So yeah, so get that regeneration of the rest of the body.
Yeah.
So again, yes.
I was invited to watch her injection. So she didn't yell, scream, or anything.
Yeah.
Just so you know.
Yeah. Again, so we do our injections up here, and I love it when patients will allow other potential patients to see and hear what's going on. It takes a lot of fear out. And fear is one of the things that keeps us held back the most. The fear of, is it going to hurt? The other fear, is it going to be effective? Is it going to work for me? And so we hear from our patients, okay, so it wasn't that bad to get it done, and it's enabled me to no longer look at going into a nursing home, but I can live my life the way that I want to. I told you to take a look at your bucket list. What haven't you done in the last 30 years that you wanted to do? You start making a bucket list. So it puts vitality back in. It doesn't just stop the pain. Now, I'll leave with this last little bit of research. I love this little bit of research. Again, as a chiropractor and medicine, there's been a little friction between the two professions for a little bit. But this research was done on medical students. So medical students were asked to participate in a study where they made their neck hurt. They put them in pain for 6 weeks. Made them hurt. They gave them a depression test at the beginning, and then at 6 weeks, they gave them a depression test and scored them. Everybody was depressed at 6 weeks because they had chronic pain. Then they said no pain for 6 weeks, and they tested them again 6 weeks afterwards. Their scores were their original scores. Chronic pain causes you to become depressed. It changes your mind, it changes your capability to think. So how many times have we heard where you go to the doctor, ladies, you're having headaches, you're having problems, oh, you're just a woman, or it's your age.
At your age.
So now at your age, you turn the clock back 10 to 15 to 20 years.
Yes. I can swim, I can do everything with my great-grandchildren.
Yes. And so now this is what medicine has looked at as just a set of symptoms, and the blinders have been on. The blinders are now off with this new regenerative medicine that we have available to us. And this is the reason I do these things is because we need to get the information out. It's not coming out in any media. It's not being reported anywhere. The doctors aren't utilizing it. The doctors aren't even talking about it. My younger brother is an orthopedic surgeon. He's not using it. My younger brother's best friend is a chiropractor. He's never referred to him. Rather than refer to him, he opened his own physical therapy clinic, which physical therapy has half the benefits as chiropractic, my research.
So my brother, whom I love and is a great guy, has blinders on. He can't see past what his training has been. So we have to become self-educated on this.
So what is that training? Because I got to deal with an orthopedic person, so I'm trying to figure out how's the best way to approach this.
How to approach the orthopedist? Look up research, ask pointed questions. There you go. Now, will the orthopedists do this? Now, the orthopedists are doing, some of them are doing the injections, and currently we've priced ourselves about 50% of what they cost.
Yeah, but told they're going to do an injection.
What injection they want to do? They're going to do steroid injection because they're going to get paid for the steroid injections. They will not get paid for these other injections.
They want to do PRP.
No. If they do, it's going to be double or triple what I would charge. And Medicare, insurance, VA won't pay for it.
They wouldn't put Synvisc or something like that in?
They will do Synvisc today. The unfortunate thing, Medicare is now starting to ask for money back. So one of my doctor buddies who's big in this in Arizona, Sun City, Medicare came back and wanted the last 3 years of his Synvisc injections returned, $1.5 million.
Why?
Because they said they wanted it.
Okay.
They don't have to give a reason. They don't have to have any logic, no medical logic behind it. They said, we shouldn't have paid you, give us the money back.
Oh, yeah, they do that.
Because the research says it doesn't work.
Oh, okay.
They really shouldn't pay for it. I made the choice of, I am not going to use Synvisc up here because it won't work. I'd rather not do it.
I've had those injections in for a few months.
Yeah.
There's some relief, and then it's right back to where it was.
Right back to where it was. Because, again, the holes in the inner tube are releasing.
Right.
And it can't grow the meniscus back. Can't do it. Now, if we could put the Synvisc with the PRP or the stem cells at the same time, I don't know that would work. Nobody's looked at that. Would it conflict? Don't know. Would it cause more of the Synvisc to multiply? We don't know. So I wouldn't be willing to risk that on anybody either. No, it's not worth it. I think in here it has the research on it, says it compares the Synvisc with the PRP.
So what does steroids do for the lower back? What's the...
Makes it worse. Accelerates the arthritis. Damages the tissue. Weakens the ligaments and tendons. Makes the discs decrease their heights faster. But you may feel better.
Can I just say something about the prednisone?
Yeah.
I have a friend who's 20 years older than I am. So I'm 72, she's 92 now. And the whole thing that you put up there about the side effects of the prednisone, she's got it all because she's been on it at least the 20 years that I know.
Yep.
And she has fallen, she has broken bones just in the last few years
Yep.
because it weakened her bones so much.
Real-
And she is skin tear city.
Yeah.
You just touch her and she gets skin tear.
Yeah.
So I think prednisone, it sucks.
Yeah. So it's disingenuous to tell people that it's healthy and good for you and not look for this. The
A
original
little short-term thing of prednisone is fine.
Short-term.
But not to be on it as long as my friend's been on it.
Exactly.
Yeah.
So that's a doctor that's not willing to investigate outside the box.
Yep.
Any other questions? Yeah.
This first evaluation, I want my son-in-law to come and do this.
Yeah.
Is that a PRP injection that you give on that?
No, we're going to use the shockwave therapy.
Okay, you do,
Yeah.
okay.
As long as it's safe for them to do that.
Yeah.
Case in point, we did one guy with this. He had a asthesis, which is where the bone falls forward and it compresses the spinal cord, strains, actually puts pressure on the spinal cord. This guy couldn't stand for more than a minute and a half. He could get up, walk to the bathroom, sit down, do his business, get up, walk back, and sit. That's all he could do. We did the EPAN on him, and he says, it's lifting off of me. It's lifting off of me. What's lifting off here? I don't know. It's lifting off of me. And then he stood up and he went, my God, the pain is gone. And he stood there for 5-6 minutes. I said, walk out to the front door and back. He goes, my legs work. I said, I think you need the help. And that was the trial one on him, and his was that immediate of an effect. Not everybody does that, but that was what like, oh, fantastic. Yeah. Oh, and we do have VA capabilities. If you get with your VA, they will cover the chiropractic care and they will cover physical therapy and rehabilitation. They won't cover any of the advanced regenerative medicine. But the other stuff that you have to do, they'll cover that now. Well, they do a very good job with that. Yes.
Just wanted to mention, when you're releasing the EPAM
Yes.
on my backs
Yes.
and neck, anyway, a side benefit was the scar tissue that had built up from an old surgery
Yeah,
that had hurt.
Yeah.
Went away.
Yeah.
So it broke up.
or except the scar tissue.
It broke up.
That's incredible. Incredible stuff. So good. You got a question. I can see it written all over your face. I just can't read what it is.
Oh, I've got so many things going on in my head, I don't know where to start. My knees, when I want to get up,
Yep.
I don't have any pain.
You got no strength.
Yeah.
So what happens with that is the knees are irritated, they're painful, and they're turning off the muscle. They're saying, don't use me.
And they feel like when I get ready to stand up, I have to wait for them to align.
To align back up.
Yeah.
Because the muscles aren't holding on to them. So that's several components. That's the knee itself. That's the proprioreceptors in the knee. That's the muscles. That's the proprioreceptors in the tendons of the muscles. That's the nerve coming out of the low back. So all those components must be addressed. And this is where we have some of the other clinics. They're only addressing sending juice into the knee. But what about the stuff that holds the knee together? What about the other components? So even with doing regen, you got to take a look at that whole big picture, not just this one little thing. So again, regen medicine done properly is this. Medicine looks at this. Medicine has gone from a big picture to a very myopic picture. I treat the skin only. Well, why is the skin doing what? If I wanted to be a medical doctor, I'd be a dermatologist. That's a rash. Rub that cream on it. Didn't work. Oh, rub that cream on it. Oh, rub that cream on it. Let's do some more tests.
Yeah.
That's it. That would be an easy job.
It seems to me that whenever you have something going on with the skin, that's because something is going on inside and it's coming out.
Liver, kidney, toxins of some point, parasites could be a part of that, but it's predominantly the liver, the kidney is having problems. So it would be with my medications for the heart transplant. They changed it on me. I was crapping my brains out. Now they gave me one that's giving me acne on my chest and upper back. And so they was at the doctor Thursday and they said, oh, we'll go see a dermatologist. That's the drugs. You got something that can maybe, no, go see the dermatologist. So I will have to research, is it the liver or the kidneys? I got to go look up the drugs, see how it works, see how it exits the body. And then I'm going to have to see what can I do to make that organ tissue work better.
So do you have a test that you run to say that you can see that your livers are not or something?
You can look at the liver. And
affected?
how I know which one it is right, I think it's the liver because the skin is oily.
So oil skin is indication.
Liver issues, dry skins, kidneys.
Did not know that.
Yeah, general factors.
So do you address those directly, the kidneys and the liver?
Yeah, I will, and I'll do it through diet, nutrition, herbs, rife generators, frequency stuff, etc. I have to be very careful because there are some of these things that I would normally use, I can't because it interferes with the drug.
They say that the liver is the only organ that will regenerate itself.
Yeah.
So how, when you have dry skin, then it's probably your kidneys, how do you help that?
It depends on what's going on with the kidneys, and that I don't, again, that becomes intricate. That's why I use my Zyto testing that looks inside the body, and then we can take a look at how do we target diet, nutrition, and exercises for that one organ system.
Boy, you just hit the nail on the head. I'm zero on all diet, nutrition, and exercises and all.
You got lots of room to work with then. I appreciate you coming out. We'll have more of these, and so when you get the next one, you go, oh, here, he's sending me another email. Forward that to somebody that might benefit from it. That's why we're doing these things. And so I want more people to get this information out to the public. We've got to get a healthier society. And right now, we're not getting it. All that's happening is it's getting worse and worse. And the diet, nutrition, the food quality, food supply, I told my wife, I said, okay, When we move again, I'm getting chickens. I'm gonna raise my own eggs, gonna get rid of our own scraps, and then I will get a garden going. Why? Because I can trust what I put into my garden, and the fertilizers that I use is going to be cow poop as opposed to the artificial fertilizers. So then I will have nutrition in my food. It's just gotten worse.
What do you think about this test tube chicken they wanna feed us?
Run.
Exactly. It'll be worse than carbonated drinks
Yeah.
because.
Watch the movie Soylent Green.
Yeah,
That's
there you
what
go.
Watch Soylent Green. Old sci-fi movie with Charlton Heston in it.
Yep.
Thank you so much for coming. I appreciate you.
Yep.
Thank you for having us.